Testing, testing, 1, 2. Is that okay? Is that too loud? Okay. What's the date today? Oh, March 26th. Oh, it's right there. Every day is Saturday, Sunday, or Monday. I don't know what day it is. Okay, just let me know whenever. Okay. Good afternoon, everyone. My name is Mayor Heidi Herzberg for the City of Deltona, and welcome to our press conference COVID-19 update for Thursday, March 22nd, 2020. Today, I'd like to welcome some other people here with me today. First of all, we will have Rafael Ramirez, Administrator of the Medical Center of Deltona. We will have Danielle Johnson, COO and Interim CEO of Advent Health Fish Memorial. We also have our District 5 School Board Representative, Ruben Colon, and we also have Fire Chief and Emergency Manager, Bill Snyder, and we have Vice Mayor Victor Ramos. So first of all, I'd like to thank you all for being here, and I will go ahead and do my comments at the end concerning city services. So first, we're gonna go ahead and start with Mr. Ruben Colon with the school board to give us an update.
Good afternoon. First of all, I'd like to thank our families, teachers, and staff for their patience during these uncertain times. Like each of you, the ever-changing nature of this pandemic has required constant adjustments to our response and plans moving forward. By order of the governor, schools are closed to students until April 15th. We have prepared an at-home learning plan called the Instructional Continuity Plan, which is available on our website. Remote learning is to begin next Monday, March 30th, for students without the technology to do the online plan. We are also distributing hundreds of iPads and laptops. The times and dates for this distribution is available online. We also have paper packets for those who are unable to complete the online learning from home. While most of these efforts focus on core subjects, there are also requirements for non-core subjects. As you are adjusting to the at-home learning, you will have options for your non-core courses. Beginning on Monday, March 30th, we will begin core instruction and will also complete an instructional continuity log for each of your non-core classes. The ICL, or the Instructional Continuity Log, offers a few examples for each of these non-core areas. Unless your teacher has communicated a different plan to you, you will use this log until April 10th. Please be sure to record at least 1 hour per week for each of your non-core classes. Career and technical education teachers will communicate a different plan of instruction by April 3rd. A printed copy is available of all of these plans at each of your schools should you not have access to the internet. Please be sure to send any completed documents to your teacher by Friday, April 3rd, and again on Friday, April 10th, unless alternative plans have been communicated by your teacher. All remaining assessments for school readiness, voluntary pre-K, and K-12 assessments have been canceled for the 2019-2020 school year. Requirements for graduation and promotion and final course grades will be evaluated as if those assessments did not exist. In other words, the students' current grades, in addition to those obtained during the remainder of the school year, will be used to determine promotion. Please understand, as of Monday, March 30th, learning will resume. The year is not over by any means. We have been in constant communication with our families and staff. If you have any questions, please feel free to reach out to the school via telephone, or if you visit the website, all of the teachers' emails are listed there in the directory. Though our schools are closed, our key district offices continue to be open while still practicing social distancing. In order to continue to support our students nutritionally, we are providing meals at 27 designated sites. In Deltona, those sites include Galaxy Middle School, Spirit Elementary, Pride Elementary, Deltona Middle School, Osteen Elementary, and Volusia Pines in Lake Helen. The district is in constant communication with the Department of Education, the governor's office, and we are also in constant communication with all the other districts in our state. We are working hard for our students and staff, and we know this is a difficult time, but our priority is our students. We are all in this together, and we will make it to an A the Volusia way. Thank you.
Thank you, sir. And next we'll welcome Danielle Johnson, COO and Interim CEO of Advent Health Fish Memorial.
Thank you, Mayor, and I'm pleased to be in front of the Deltona community once again. So first, let me say that we are facing some unprecedented times as we continue to plan for the worst and pray for the best with this COVID-19 pandemic. There are three distinct phases to a pandemic event. It's containment, mitigation, and surge. While we are dealing with an invisible threat in a pandemic episode, it may feel very familiar to us because we follow the same phases through a hurricane season. So what I want to help you understand is what are we going through and how it relates to us in both the hospital and within the community setting. So each year as June approaches, if I'm similar to all of you, I begin to take inventory of my home supplies, such as water, food, and gas for my generators. That's really what containment begins. It's really when we have the threat of something that's approaching us like a hurricane, but in this case, it's a pandemic, which is a small traceable source of a virus in a geographic area is what triggers that containment phase. So in the community, what we see are recommendations to employ social distancing, good hand hygiene, home quarantining, and in the hospitals, we're prepared for the threat by opening things like a command center. So with Advent Health, in 7 counties, we have over 4,400 licensed beds and 600 ICU beds. So we've created a command center that's actually being led by our CEO at Fish, Rob Deininger, at our corporate headquarters. So what he's done is he's pulled together an infrastructure of resources that have created teams around key areas to guide infection control practices, clinical guidelines, supply chain strategies, to pursue alternative sources of equipment and supplies. And we've even placed tents out and outfitted them in case we need additional care locations as the pandemic event unfolds. So as a hurricane approaches Florida, we begin to mitigate. We do things like we board our windows, we put gas in our cars, and we prepare to batten down our hatches. Well, right now, we've now launched our mitigation phase because there's evidence that the virus is now within our community. So just like we board up our windows, we've got to board up our face with a mask. So when you think about this, you spread the virus by coughing and by sneezing and being in close proximity to others. So one of the most important things we can do is actually cover the source by wearing a mask. And we need to stop our social visitation for hospital patients. So you'll see that in the hospital setting, we're not allowing all the visitors that we normally had done. So visitation is now very limited to only clinical exceptions. The other thing we've done is we've actually stopped doing elective procedures. So we're still doing time-sensitive procedures, but not elective procedures. Those have been deferred until after the pandemic event has actually left us. The other thing that we've done that you'll see, especially in the emergency departments, is that we are segregating patients. So if you come to the hospital for emergency care, you'll actually see a table outside of the walk-in entrance as a way to be able to separate people who have respiratory problems versus non-respiratory problems. So when you approach the table, you have to be 6 feet away, and there's somebody who's fully garbed in a mask and a gown, and they're going to ask you, can I help you today, and what brings you to the hospital? And if it's respiratory related, they're going to give you a mask, and they're going to take you to a different location outside of the regular emergency department. That's because what we don't want to do is we don't want to mix the two together. So by doing that, what you do is prevent cross-exposure of people who are coming to the emergency department for, let's say, a cut hand and they need stitches from somebody who's got a respiratory problem. If it's determined that they're sick enough and they need to be admitted to the hospital, we actually will put them in a dedicated unit that's outfitted with other individuals so that you're not cross-contaminating patients that are sick in the hospital with people who don't have suspicions of a COVID infection. Just like in a hurricane, we hunker down, we pull together and keep everybody safe. That's exactly what we're doing in Advent Health. We're leveraging our size and our resources across over 50 hospitals, a variety of outpatient centers and centric cares. We've employed predictive models to be able to help us determine where we need supplies, where we need staff, where we need equipment as the volume increases and the prevalence increases amongst the community, and we find ourselves with a surge of patients needing hospital care. So with that, I want to leave you with one key resource, and that is that if you have questions about if you might be sick, if you need to get tested, how to go about accessing care, while not being sick enough to actually warrant hospital services, Advent Health has created a call-in number that's staffed by healthcare professionals. That number is 877-VIRUS-HQ, and that's VIRUS-HQ. And with that, I will keep the community and my thoughts and prayers as we go through the rest of this pandemic event. Thank you.
Thank you, Danielle. And now we'd like to welcome Rafael Ramirez with the Medical Center of Deltona.
Thank you, Heidi. My name is Rafael Ramirez, and I'm the administrator of the Halifax Health, UF Health Medical Center of Deltona. As we reported, I guess a week ago, our role has remained unchanged. We are ready to care for your communities, and our staff and facilities are prepared for a significant increase in the number of patients if COVID-19 begins to further spread. Our 3 hospitals have been designed and built to accommodate surges in patient population, virtually allowing us to double our bed capacity if needed. Our commitment remains the same and remains unchanged. We are open 24 hours a day, 7 days a week, and our 4,300 team members are prepared to once again, as we do during hurricane seasons, serve our community in a time of crisis. In addition, our exceptional staff of highly nurses, and also we have expert physicians representing 54 subspecialties. While this pandemic is upon us, we continue to serve our community with, among others, the area's only Level 2 Trauma Center, the only Level 3 neonatal intensive care unit, the only comprehensive stroke center, the only Center for Transplant Services, the only pediatric intensive care unit, the only pediatric emergency department with pediatricians, the only child and adolescent behavioral services unit, and the only OB emergency department. Most recently, we were also recognized as one of the top 50 cardiovascular hospitals in the United States. We are fortunate at Halifax Health to have full-time in-house infection control specialists and epidemiologists who are working nonstop to help us understand, communicate, and prepare for the latest developments. As I stated before, in order to maintain the safest environment for our team members, patients, and visitors, and to plan for the increased possible demand, we have set up emergency service tents and separate screening areas at all of our hospitals. This will facilitate quicker and safer screening of patients who present with the highest suspicion of COVID-19 symptoms. Our Medical Center of Deltona unit is ready for when our demand of patients require its opening. As established by the CDC and health departments, we are not screening patients without specific symptoms. A person who is tested because of the symptoms, contact or travel as confirmed by a physician or nurse will have a specimen test taken. The samples will then be sent to the closest lab to check the test. We are diligently working on an alternate source that can offer test results in a shorter time frame and hope to have that in place by the earlier part of next week. Remember, you should always remain in self-isolation and care for yourself as if you have the flu while you wait for your results. Also, please remember that the governor issued an executive order to cancel any elective surgical cases or procedures that will not make the patient's health in a worst case. These decisions are made with strict review from medical professionals to protect the patient and reduce infection opportunities, and also to preserve the much-needed protection equipment. Again, patients with fever and respiratory infection symptoms are placed in isolation for the protection of the staff and other patients. They're seen and evaluated by a qualified medical provider, and appropriate treatment is provided. Anyone entering an isolation room will wear personal protective equipment that includes the gloves, gowns, respiratory protection, and eye protection. Beginning yesterday, March 25th, Halifax Health will no longer allow patient visitation except for these exceptions. Patients under the age of 18 can be accompanied by one adult visitor, normally a parent, legal authorized person, or caregiver, and no additional visitors or siblings will be allowed. Another, patients in the neonatal intensive care unit may have one adult visitor, and obstetric patients may have one adult visitor as well. Exceptions will be made for extenuating circumstances such as end-of-life or unique patient needs. This new visitation policy will remain in effect until the threat of the spread of COVID-19 ceases. All visitors will be screened for symptoms of the flu and possible COVID-19. Anyone with flu-like symptoms will not be allowed access. Our staff is participating in daily, twice-a-day, in-house conference calls to better manage this pandemic at Halifax Health and its 3 hospitals. A critical part of this preparation effort has also included the early-on designation of isolation areas in all 3 hospitals for patients that need virus treatment, especially those that need ventilators or other respiratory care. Obviously, the goal here is to protect every sector of our system's population. Lastly, while we're making every effort to educate and inform the public on ways to remain healthy, please remember, include rigorous and frequent hand washing, isolation, social distancing, etc. Please refer to halifaxhealth.org, our website, and other social media outlets for frequent updates. Thank you, Mayor.
Thank you, sir. And now we'd like to welcome our Fire Chief and Emergency Manager, Chief Snyder.
Thank you, Mayor, and good afternoon. I'd just like to give you a brief update on what we're doing at the fire department and some of the things that you could do to help us out. During these unprecedented times, the Deltona Fire Department is working hard to keep our community safe. We're monitoring all new information as it comes out from Volusia County Emergency Management, from the CDC, and from the Florida Department of Health. We're also monitoring for any new updates that may be coming out from our county medical director as it relates to changes in our medical protocol. When you call 911, a dispatcher will not only ask you questions about the specific reason you called, but they will also be asking specific questions as recommended by the CDC and the Florida Department of Health as it relates to COVID-19 symptoms. Our paramedics and EMTs, when they respond to medical calls, will be wearing masks, gloves, and eye protection. This protects not only our crews, but also the citizens from any potential exposures. To ensure our personnel are healthy and able to provide the highest quality of service to our community, we are performing baseline health checks on all of our personnel at the beginning and at the midpoint of their 24-hour shift. We're asking them things like, do they have any flu-like symptoms? We're doing assessments on them to ensure that they don't, and that we're also doing temperature checks on them to make sure that they are ready to go out and serve the community in a safe manner. In addition to our normal hand washing and decontamination practices, all Deltona Fire Rescue stations, fire apparatus, and transport vehicles are being disinfected regularly with an automated automated aeroclave decontamination system. The system produces a disinfectant fog that safely and effectively disinfects all surfaces within our units. We are also restricting all visitors from our fire stations until further notice. This is in an effort to keep both you and our firefighters safe. We're doing everything we can to try to keep our firefighters safe so that they're able to be there when your emergency happens. This also includes we're not going to be accepting any sharps containers for the near future. We're canceling all of our public education events and also our monthly CPR classes, again, until further notice. However, if you do need something from us, say like, for example, a fire report or anything else from us, you can give us a call, and our number is 386-575-6901, and we'll do our best to help you with whatever your needs are. What can you do for us? We ask you, our community, to continue following all the recommendations from the Florida Department of Health and the CDC. Wash your hands regularly and for at least 20 seconds. Cover your mouth whenever you cough or sneeze. Social distancing, staying at least 6 feet from other people, and also in groups of no larger than 10. Don't touch your eyes, nose, or mouth, as this is a direct conduit into your body and into the system. And also, please, if you are sick, please stay home. All of these will and have helped reduce the spread of COVID-19. If you are sick with flu and cold type symptoms, please go to your regular doctor or your urgent care like you normally would if we didn't have this pandemic. However, if you're experiencing life-threatening symptoms like shortness of breath or chest pains or something like that, then please don't hesitate to call 911 or go directly to your emergency department. If you have any questions or concerns related to COVID-19, we ask that you call the Florida Department of Health's emergency hotline. That number is 866-779-6121. Again, that's 866-779-6121. I just want to let you know that our fire department personnel are dedicated to keeping our community safe during these unprecedented times. And if there is anything that we can do for you, please give us a call. And again, our number is 386-575-6901. Thank you, and please be safe out there.
Thank you very much, Chief Snyder. So I'd like to do a couple of updates regarding state and local news. First of all, today, from the governor's office, the Department of Revenue is now extending the property tax payment due date from March 31st to April 15th. So if you have not paid your property taxes yet, you have now until April 15th instead of March 31st, and that came down today from the governor's office. Concerning Deltona, first of all, we'd like to let you all know that City Hall is still open. We do, however, encourage you to go online and do any permitting applications or any business that you can online at deltonafl.gov and follow the links to permitting and building, because by doing that, you minimize your contact with employees, and our employees minimize contact with the public. Our employees are behind a plexiglass system that is somewhat safer than a lot of the other municipalities, but we still want to minimize any contact that they can have for the public. We also want to let you know that the City of Deltona's parks remain closed until further notice. We'd also like to let you know that we're in constant contact with Sheriff Chitwood and the Volusia County Sheriff's Department. The Sheriff's Department remains fully staffed and servicing the City of Deltona 24 hours a day, 7 days a week. We also maintain communication with Volusia County and the state of Florida. Our interim city manager, Dr. Cooper, has conference calls with the other city managers 3 times a week, and we have a mayor's call once a week. So we are in constant local communication to see what's going on in other municipalities around Volusia County. Trash pickup is still running as normal. There may be a possibility of some delay due to COVID-19. Please be patient with our waste providers. They are on the front lines of still having to go out and pick up everyone's trash. Please make sure that you secure your trash and that you don't just dump things in the bin, in the bucket, and provide any hazard for our waste providers. So the next thing I'd like to say is concerning our commission meeting, April 6th. As of now, we are still planning on holding the next commission meeting on Monday, April 6th at 6:30. This meeting, however, will be closed to the general public. We would like to have the residents submit any comments that you have, any requests, any comments on items on the agenda online. We are planning to put our agenda out early. We are going to put the agenda out on Monday so that residents have enough time to review the agenda and prepare questions for the commission. Public comment can be submitted several different ways. First of all, visit www.deltonafl.gov, our website. Click the City Commission icon on the left. Click the Request to Speak on the list to the left, and fill out the Request to Speak form, which will be submitted. You can also email the city clerk. The email for the city clerk is cityclerkdept@deltonafl.gov. That is one word, cityclerkdept@deltonafl.gov. We also have a fax number, 386-878-8501. And lastly, you can also come in person and submit your request. There is a black customer service box at Deltona City Hall in 2 locations. In the first floor main lobby on top of the trophy cabinet on the right, and on the second floor in the city clerk HR lobby. Deltona City Hall is located at 2345 Providence Boulevard. So if you would like to submit any public comment for this coming meeting on April 6th, please do so in those following formats. So just a couple of other updates on COVID-19. If you would like the most up-to-date information, go to the website floridadisaster.org. That's floridadisaster.org. It's a comprehensive website that lists the total cases positive, the cases tested, and breaks everything down not only by county, but by city. So as of last night's posting, Volusia County had 28 positive COVID-19 cases. There is now 1 positive case in the city of Deltona. According to Sheriff Chitwood, who on his website or on his Facebook page posts every night the homes monitored throughout the county, as of last night, Deltona had 11 homes being monitored. The other question that I've heard a lot, and most of us have, is there drive-up testing? As of now, as you've heard from our healthcare providers, there is no drive-up testing at all in Volusia County. That has not been implemented as of yet. Testing is limited. As of yesterday, we pretty much tested about 290 some people, and those were 28 positive cases. Today's numbers that came out at 11 o'clock, statewide added over 300 additional positive cases. So if you want an accurate count, please go to the floridadisaster.org website. Testing. The testing is limited, as you've heard from both of our healthcare providers. This is not a local issue. This is not a Deltona issue. This is not a Volusia County issue. This is a statewide, and in some cases, a nationwide issue. Not only are tests at a premium, there's a shortage of swabs to perform the tests. There's also a nationwide shortage of reagents that work with the tests. So until those issues are resolved, testing is going to remain in place for basically those people that show the symptoms and meet the CDC criteria. And you can also see that on a link on our website. The City of Deltona's website has multiple links to the CDC and the Department of Health. Many of you have also asked about a stay-at-home order. Neither the City of Deltona, the County of Volusia, or any city in Volusia County at this point has a stay-at-home order or a shelter-in-place order. There is no desire to do that as of now. That has been clearly stated by the county and by the majority of the mayors that they do not wish to have a stay-at-home order at this point. So, since that is not the case, I have looked around the City of Deltona and the County of Volusia, and I am so amazed and proud of the residents who are actually practicing social distancing. You are doing a wonderful, great job of practicing social distancing. So many of you are staying at home. You're sheltering in place, you're only going out for the necessities, and you're keeping those most vulnerable people of our community safe. You're being very, very cautious with the elderly and with those people that have underlying conditions that could make them a prime target for COVID-19. Please, please stay home as much as possible. As you know, grocery stores, gas stations, all those things are still open for you. But please maintain social distance and shelter at home as much as you can. It is for not only your safety, because all of us could be carriers. We don't know that yet. It is for the safety of those people in our community that are the most vulnerable. So right now, I'd like to ask Vice Mayor Victor Ramos to come up and just give a quick synopsis of the City of Deltona and our program just in Spanish for those of you that are listening and going to be watching online at a later date. Thank you, Vice Mayor.
Thank you, Madam Mayor. Buenas tardes. Nuevamente, simplemente para darles unos puntos sobre de lo que está sucediendo aquí en la ciudad. City Hall se mantiene abierto y recomendamos que por favor, antes de llegar, que llamen o se comuniquen con a través de nuestra página de web. Nos mantenemos, como pueden ver, en contacto no solamente con los hospitales, sino con el sistema escolar, pero también nos mantenemos en contacto con el condado y nuestro representante estatal para ver qué es lo que es necesario para nosotros hacer. Como el alcalde mencionó, nuestra reunión de la comisión estará todavía el día 6 de abril, pero será cerrada para el público. So, si cualquiera persona que quiera hacer un comentario para la reunión, esperamos que por favor se comuniquen de nuevo con City Hall y tienen hasta el día 3 de abril para entregar eso. De nuevo, esperamos que por favor se mantengan safe. Por favor, si no es necesario salir, no salgan. Lo otro es que el horario de recogida de basura sigue igual. Eso no ha cambiado. Lo otro es que los impuestos de las propiedades se han extendido hasta el día 15 de abril. De nuevo, esperamos que por favor se mantengan en sus casas y si no es necesario salir, por favor, no salgan. Muchísimas gracias. Thank you, Mayor.
Thank you, Vice Mayor. I'd like to thank everyone that was part of this press conference today. Did you have any questions? Yes, sir.
One for the mayor and one for the fire chief. Regarding the April 6th meeting, is it fair to say that the media will be admitted to the meeting?
Right now, we're admitting no one to the commission chambers at all to practice social distancing. The meeting will be live streamed, it will be on TV, and it will be live streamed on our website as it normally is. If the media has any questions, you can please submit them as well online.
We may be doing that. Also, too, well, will all commissioners be present?
Yes, and they will be present if they can come. I'm not speaking for any other commissioner. Every commissioner, will be there unless they feel uncomfortable or they maybe are ill or out of the area. We don't know that at this point. I have no idea. They would let the interim city manager know that. We will be practicing social distancing. There will be tables on the floor. They will be 6 feet apart, and that's how we are going to set this up. So you will still have the video. GTV will still be able to see everything, and we're going to go ahead and set the tables up down here. We will not be on the dais because you cannot be 6 feet apart on that dais. So that is how it will be set up down here on the floor. Okay?
Later. As far as for the fire chief, Chief Snyder, have you seen an increase or decrease in the number of EMS calls? I mean, more people being home, is there perhaps less calls because people are out on the roads less? And are people hurting themselves more doing things around the house? Or?
As this started, we did see an uptick in calls, especially flu-related type calls. It is a pretty, not only are we having this pandemic, but it's also a pretty bad flu season and allergy season as well. So we did see an uptick at that at the beginning of this, but it has kind of leveled off, and our calls are pretty much back to normal as of this point right now.
Okay, all set? So once again, I'd like to thank everyone for participating, our healthcare providers, our school board representative, our, of course, emergency manager, and I'd like to thank all of city staff who continues to work throughout this pandemic. And on a personal note, just me, this is not the flu. COVID-19 is not the flu. There is no shot, there's no vaccination. This is a completely new disease that affects the respiratory system, and it affects it in a much more harsh way than the flu does. I welcome anyone that will correct me after this pandemic is over and after Deltona and Volusia County are in the clear, but we are not in the clear yet. There have been comments made that this is our peak. We are at our peak now. We are not, ladies and gentlemen, at our peak. The modeling suggests this can go through May. And again, that is my opinion. I'm not a scientist, I'm not a doctor. However, I still encourage all of the residents of Deltona to practice social distancing. Be safe, stay home if you're ill, don't go out unnecessarily, and above all, take care of those members of your community that are most vulnerable. They need all of us. Thank you very much, and more than likely, we'll be doing another one of these on Monday.